Hi, y'all. 5 things that you should know about your blood pressure in pregnancy. I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So, Black women, your blood pressure is very, very, very important in pregnancy. Your blood pressure is one of your vital signs. Vital. Just indicating how critical it is. So it's very important that your blood pressure is well controlled. This is important to stay healthy throughout your pregnancy and also in that postpartum period, the period after pregnancy. What is high blood pressure? High blood pressure is what you hear referred to as hypertension. So hypertension is when your blood pressure is high. Hypertension and heart disease are the number one killers, of Black women during pregnancy or after pregnancy. So our number one cause of maternal mortality is cardiovascular, hypertensive heart issues. That's why controlling your blood pressure is so critical to preventing death, especially among Black women, because we are at higher risk for hypertension to start with. So number one, let's talk about what happens when your blood pressure is high. When your blood pressure is high, you're at risk for death. At risk for death because it can cause a stroke. The high blood pressure can cause the blood vessels in your brain to burst, bleeding in your brain, and that's what a stroke is. It can cause a heart attack, problems with your heart. That high blood pressure pounding your kidneys can kill your kidneys. It can also affect all of the other organs in your body. High blood pressure going towards the uterus and the placenta where the baby is can cause something called a placental abruption, where it kind of pushes the placenta, causes it to separate away from your uterus, causes you to have severe bleeding where the baby can die, you can die. So high blood pressure can have a lot of bad effects. That's why we're talking about it. Number two, what are signs that your blood pressure is high? Sometimes you have no signs at all. That's why they call hypertension sometimes the silent killer, that your blood pressure is high. But in pregnancy, there are times when you get an indication. Sometimes you get a headache that's not going away. You take Tylenol, it's not going away. That's an indication to check your blood pressure. You have visual changes. You're seeing spots and floaters or your blurry vision. That's an indication that something might be wrong, that you need your blood pressure checked. Sometimes you get swelling in your face, in your hands, in your feet that are worse than usual. It's typical during pregnancy. You might have a little bit of swelling in your feet, but when it starts, your whole body starts swelling, you might need to check your blood pressure. So those are the signs that your blood pressure might be high in pregnancy. Number three, Black women, I think, should take their blood pressures regularly during pregnancy. Buy your own automatic blood pressure machine from Amazon, online, from grocery stores, pharmacies, and take your blood pressure at a minimum weekly in that first and second trimester, all the way up until 28 weeks or so. Take your blood pressure at a minimum weekly, write it down so that when you go for your doctor's appointment, you can, if your doctor wants to see them, you can review and say, okay, I've been taking my blood pressures, they've been normal. When you get to be in the third trimester, that's when you're more likely to get the preeclampsia happening, where your blood pressure shoots up during pregnancies. You can have seizures, things like that. That's when I recommend that you take your blood pressure once a day. Take your blood pressure daily, write it down. And then if you do have hypertension, or you develop hypertension during the pregnancy, then you should take your blood pressures twice a day and write them down. Your doctor typically wants to review those. So very important that you should be taking your blood pressures, Black women. All right, then number four, you need to know what the blood pressure parameters are. What's normal, what's high. So a normal blood pressure is when the blood pressure has a top number and a bottom number, a systolic number and a diastolic number. That top number, we need it to be less than 120. We classify them as millimeters of mercury. You don't need to know all that. You don't need to know systolic, diastolic. All you need to know is my top number and my bottom number. So your top number needs to be less than 120 and your bottom number needs to be less than 80. That's a normal blood pressure, 120/80. All right, what's a high blood pressure? When that top number is 140 or higher, that's considered high. When that bottom number is 90 or higher, that's considered high, greater than 140 over 90. And then what's considered severely high during pregnancy? It's different when you're not pregnant, but when you are pregnant, if that top number is 160 or higher, that is severely high. If that bottom number is 110 or higher, that is severely high. Greater than 160 over 110, greater than or equal to. Alarm bells need to be going off whenever you see numbers that high. Managing your blood pressure, you need to know about this. Chronic hypertension, if you come into pregnancy and you already have hypertension, we call that chronic hypertension. Take your medications as prescribed. Keep your blood pressure low. You might develop preeclampsia or gestational hypertension. Those are things called pregnancy-induced hypertension. We don't understand them very well, but we know they can happen during pregnancy, sometimes early, 24 weeks, 28 weeks, 32 weeks. And when it happens, sometimes we have to deliver the baby early. So if you develop preeclampsia or gestational hypertension, they might not treat you with medications because they might be monitoring you and keeping a close eye on it and might have to deliver you because of that. But in the hospital, they'll treat you with medications to keep those blood pressures low and keeping them from becoming severe. Now, if your blood pressures, however, ever reach that severe range, 160 over 110, greater to or equal to that, you do need blood pressures. Whatever the reasons, you need blood pressure medications to bring those blood pressures down. And typically, if you have those severe high range blood pressures, you need to be treated within an hour. So when you have those high blood pressures, let your doctor know. If you're in the hospital, call your nurses. Be aware that our recommendations are to treat severe blood pressures within 1 hour. There's been studies showing that there are delays in treating Black women, and that can contribute towards their death. So you need to know to not tolerate delays. You need to notify your doctors, your nurses, and to ask about receiving treatment within 1 hour. So Black women, monitor your blood pressure in pregnancy. It is the number one killer. Cardiovascular problems and high blood pressure problems. Number one killer of Black women during and after pregnancy. Monitor your blood pressures during pregnancy. Monitor your blood pressures in that critical postpartum period. Those first 6 to 8 weeks or so after you've had the baby. You need to be monitoring, taking your blood pressures daily. Daily blood pressures, for those first 6 weeks. And you need to insist that your blood pressures are treated if they are high. You need to know this information. You need to insist on treatment because we need you to survive and thrive.